In this second video, we'll talk about muscles that are found in the head and the neck. Many of these are called muscles of facial expression. Think about how, without communicating, you can tell if somebody's happy or deep in thought or surprised, right? All of those are facial expressions that are created by these muscles here. Many of the muscles in our arms and legs go from one bone to another bone, right, with those tendons at the end. But these muscles of facial expression are unique. They usually attach to the skull, and then they attach to the skin. That's why it can pull the mouth up in a smile or make you snarl or flare your nostrils. Most of these are controlled by the same nerve, cranial nerve 7, but that's a little misleading because there would be like a left cranial nerve 7 going to this side of this person's face and a right cranial nerve 7 going to this side. Maybe you've seen someone that had damaged a nerve and then they had paralysis to several muscles on one side of the face. The epicranius relates to my drawing of Homer Simpson. It literally wraps all the way around the skull from the front to the back. And the muscle portions of that are called occipitofrontalis. There's a part in the back where the occiput is and a part in the front where the frontal bone is. The front and back are connected by connective tissue called an epicranial aponeurosis, where it all blends together. If I contract the frontal belly, it raises the eyebrows. When the occipital belly is contracted, it pulls the scalp back. Here's the epicranius, here's the frontal belly. When this one's contracted, the eyebrow goes up. The occipital belly, when this is contracted back here, it kind of pulls all the skull toward it here. This is where I was saying it's kind of hard to see where it's talking about that this is the frontal belly here and it's been removed on this deeper side. We can't see the occipital belly that would be in the back. What I can see in this deep view is this corrugator supercilia muscle. Supra tells us it's going to be above something. Cilia is the eyebrows. It draws the eyebrows together like when you're thinking really hard. There'll be some other muscles involved with this as well. This procurius would also be involved with deep thought, just involved a little lower down on the nose. Just staying on the picture here using the terms, orbiculus oculi makes an orbit around the eye. If I contract it, it closes the eye. Here it's been removed so I can see this deeper structure, the one that helps my eyelid open, the levator palpebrae superius. Let the words help you. Levator because it elevates this. Palpebrae is a fancy name for your eyelid, and superior tells us it elevates it superiorly, like to open the eye. So my orbicularis oculi closes the eye, levator palpebrae opens the eye. The nasalis muscle are like nasal strips. If you've ever used those or seen them on commercials where they go right across the top of the nose. Here would be their nasalis. Here's that procurius I mentioned earlier. We had orbicularis oculi. We also have orbicularis oris going around the mouth. It makes a ring around the mouth. Labii are lips. And if I'm a depressor, labii inferior, I pull your lip down. Versus if I'm a depressor anguli oris, I pull the corners of your mouth down, like when you're frowning. Levator labii superius is above the lip, so it's going to pull the lip up. It's been cut over on, it's been removed on the deep side here. I also have a levator anguli oris, letting the words help us. This one pulls the lip more at an angle. We also have two muscles. Remember, major is always the bigger one. So right in here would be this person's right zygomaticus major, and here is their right zygomaticus minor. Those make you smile. Zygomaticus makes you smile. Orbicularis oris closes your mouth. Orbicularis oculi closes the eye. Depressor pulls something down. Levator pulls something up. If we go straight to the side, we have the risorus muscle. Pulls the mouth to the side. I think about the Joker in the Why So Serious. If you remember that, you'll understand why risorus goes right to the side. The mentalis sticks out the lower lip. Comes from the point of the chin. Here would be their left mentalis. Here's their right mentalis. The buccinator goes towards the lip, and it's covered up by this other muscle called the masseter. We'll see those in a side view a little bit better. And again, the muscles that make you smile, zygomaticus major and minor. In the side view, we can't see everything as well, but we can see this orbicularis oculi, orbicularis oris, that mentalis coming from the point of the chin. If I'm going to pull the lip down, I'm probably a depressor labii. If I go to the angle, I'm depressor anguli. Here's that buccinator, and the buccinator goes all the way to the mouth, versus here's that masseter, and the masseter is more going up and down. We can also see in this view why it makes more sense. Here's the much larger Zygomaticus major, and here's the smaller Zygomaticus minor. This would be their right one. Pull up their right side. Kind of like this drawing in here, depressor anguli oris pulls the angles of the mouth down. Orbiculus oculi tightly closes the eye. Orbicularis oris, I mean, these are the flirting muscles, right? There's a wink, and here's the frontal belly of that occipitofrontalis raising this up, and we could just do one side, right? The other two I haven't covered so we can see them. There's a much broad muscle here called the platysmus. It's literally like a whole sheet of muscle. And it's often confused with this thick muscle here called the sternocleidomastoid. But if we go back to this drawing, here's my superficial side, and I can see that superficial platysma, the one we're seeing contracted here. Underneath it would be that sternocleidomastoid. I mentioned damage to a nerve, but there's lots of things that can actually cause facial paralysis. Sometimes it's idiopathic. Good word to know. Idiopathic means we don't know what caused it. And oftentimes, unfortunately, in healthcare, we'll use that and hope we're not caught on it. They're like, oh, what happened to mom? She had this situation. What did the doctor say? Oh, it was idiopathic. Oh, that's much better than what the doctors say. They didn't know what caused it. All right. Sometimes it's called Bell's palsy when that facial nerve is involved. It could be temporary. Sometimes this happens after dental work or after a trauma. It's usually treated with anti-inflammation and some steroids, and most of the times it'll go away, but it really depends on what caused the situation. And again, it's probably just going to affect one side and not the other. In this table 11.1, you can see where I highlighted key things about each muscle. We can also see how most of these do have that same innervation. Cranial nerve 7, the facial nerve, goes to almost all of these. As we get down here, there's the one where we were opening our eye, that levator palpebris. He's cranial nerve 3 to open the eye, but everything else, muscle of facial expression, was cranial nerve 7. Extrinsic tells us these are not muscles inside the eye, they're outside the eye. And if we learn that word, we can understand about extrinsic ankle muscles, muscles that are not in the ankle but cross the ankle, or extrinsic hand muscles, muscles that are not necessarily in between the bones of your hand. Maybe the muscle starts up in the forehand. All right, extrinsic eye muscles, muscles that are not inside the eye, they're around the eye. There are 6 of them. 4 of them have rectus in the name. Remember, rectus means straight. 2 of them have oblique in the name. Oblique means it runs at an angle. The 4 rectus muscles share this really cool common tendinous ring. Here we're seeing someone's right eye. Well, here someone's right eye has been removed, and we can see 4 muscles. Going straight underneath it is the inferior rectus. Going straight above where the eye would be is the superior rectus. If I go toward the nose, I'm going to find that medial rectus. And if I go straight to the side, I find the lateral rectus. So the lateral rectus would make this eye look that way. The medial rectus would make this eye look that way. Superior rectus makes it look up. Inferior rectus makes it look down. Because the curvature in here, the superior and the inferior rectus, they actually move the eye in 2 directions. The superior rectus makes the eye look up, but also makes it want to pull medially. Same thing, the inferior rectus makes the eye look down, but it also wants to pull it medially. Another interesting thing is there's a different nerve that controls this lateral rectus here versus the other muscles. Cranial nerve 6 makes you look out to the side. We'll talk much more about that in our last module together. Besides the rectus eye muscles, we have muscles that run at an angle. We have an inferior oblique. Notice the way it's running at an angle here, and a superior oblique. The superior oblique goes to this really cool structure here called a trochlea. That would be good to know. Which extrinsic eye muscle goes to the trochlea? The superior oblique muscle. What's the superior oblique muscle do? Because of the way it rolls, it actually makes the eye look laterally. What's the inferior oblique muscle? The inferior oblique makes the eye look laterally. That makes sense because the rectus we're making it look medially. So these cancel that out. They're showing us where the plane is here. We have a sagittal plane, but it's not in the middle. We still have a left and right. So we're looking at their right eye. Here would be their lateral rectus, the superior rectus, the inferior rectus. Now we can see parts of the inferior oblique and that superior oblique, the way it wraps around that trochlea. Such a cool way, right? What a wonderful anatomical structure. In this superior view, we can see how the muscles that we just talked about are arranged much more superficial than the optic nerve. In the last module, we'll talk about the optic nerve. The information inside my eye has processed, and it sends it to my brain to tell me what I saw. I will see you in the next video.